Good afternoon. Nevada Primary Care Association, Blue Novo, and Collaborative Ventures Network would like to welcome you to today's webinar, Technology Enablement for Patient Engagement. My name is Brandy Johns, and I'm the Training and Development Manager of Nevada Primary Care Association. Nevada Primary Care Association is a nonprofit organization dedicated to improving access to high-quality, community-based, affordable primary health care in Nevada. We provide training and technical assistance to community health centers and partners to improve access to health care for all, especially for underserved and uninsured populations. For more information, visit us at mvpca.org. Collaborative Ventures Network, through their Healthy Communities Collaborative Network, or HCCN, an initiative funded by HRSA, supported a total of 26 health centers from Arizona and Nevada. HCCN's goals include the use of health information technology, electronic health records, and population health management tools to provide actionable data, aggregate and compare performance metrics, and improve clinical quality results reporting. We are happy to come together today to provide this webinar to support your health centers with patient engagement. For more information, visit them at healthyarizona.org. Before I get started, I'd like to go over a few housekeeping items. During the presentations, please make sure to mute your phone or computer so that we don't have feedback or background noise. Also, please be sure not to put your phone on hold or we will hear your hold music. You will have the opportunity to submit your questions to today's presenter by typing your question into the chat panel. You may send your question at any time during the presentation. Questions will be collected and addressed during the Q&A session at the end of the speaker presentation. They will also take questions at different times during the presentation. Today's session will be recorded and slides will be available to participants. I would now like to welcome today's speakers, Fernan Capras, Chief Technology Officer of Blue Novo, and Ana Maria Izquierdo, Chief Medical Officer of Blue Novo. Thank you, guys.
All right. Welcome, everyone. Thank you so much for joining us for this webinar. My name is Fernan Capras. I am very excited to talk to you all, along with Dr. Ana Maria Izquierdo, about this topic, just given its important role on the road to value-based healthcare, but also because of the current healthcare landscape in COVID-19. Now, Blue Novo is a healthcare technology consulting and IT managed services firm focused on supporting FQHCs nationwide in all aspects of technology. A quick glimpse into my healthcare background: I began my career in IT support, implementing an electronic health record at a private practice in the years leading up to meaningful use. From there, I shifted to the patient care end of things, becoming a registered nurse and working in a telemetry unit at a Florida hospital before finally ending up in the technology consulting end of things, where I am now implementing, optimizing, and supporting various EHRs in ancillary tools, including patient engagement apps, patient portals, and the like. Like I mentioned, I'm joined by Dr. Ana Maria Izquierdo. Ana Maria, did you want to briefly introduce yourself?
Sure. So my name is Ana Maria Izquierdo. I am an internist and a geriatrician, and for most of my career, I have seen patients in community health centers. I was the medical director of one community health center in BC, and I have always been very interested in how to deliver care in a way that reduces health disparities to the extent that they can be reduced. I am the Chief Medical Officer of Blue Novo and also the Chief Nerd Officer. So I'm very interested in analytics and what sense we can make of the data we produce. For now.
All right. Sorry, 1 second. Okay. So the learning objectives for this webinar, there's 3 that we wanted to cover. 1, increasing patient portal and patient engagement adoption. We'll talk about patient portals and their background and lay the groundwork for our webinar. We're going to review the adoption considerations from both the patient and the care team provider perspectives. Number 2, we're going to talk about increasing patient engagement beyond the portal, where we'll cover strategies all health health centers should consider including in their patient engagement strategy. And then number 3, patient engagement deployment best practices, where we'll review practical aspects to consider when deploying any application, but specifically patient engagement and patient portal applications. Now, our hope is by the end of this presentation that you can take away 1 or 2 nuggets that will help your organization view patient engagement in a different light. Increasing patient portal and patient engagement adoption. Now, in this first section, we'll want to talk about ways to increase patient portal and patient engagement adoption. In order to achieve patient activation, which is the term we use to capture the patient's willingness and ability to take independent actions to manage their health and care, this is a critical element to achieving success in a value-based environment. Now, before we get started, Brandy, can you put up poll number 1 for me, please? All right. So how would you rate your patient portal adoption? If you could just take a minute to complete that poll, we will review everyone's feedback. Give it another minute. Awesome. All right. So thank you for being honest. I think this is, what we essentially expected to see. Okay, so we see what the numbers are looking like. Now, as our starting point, let's use patient portals in 2014. Now, in pursuit of meaningful use requirements, organizations invested heavily in their patient portal. Now, as a result of a 2015 study by the ONC, we saw nearly 90% of both eligible providers and hospitals offering patient access to the portal, and most patients followed up with portal registration. However, an analysis in 2017 by the Government Accountability Office, or the GAO, found that despite those high numbers, patient activation on the portal left a lot to be desired, where only 15% of eligible providers and 30% of hospitals saw any patients view, download, or transmit their patient portal data. Now, portals have traditionally been geared towards providing patients access to their health records and perhaps conduct some administrative interactions, but they have not always been a comprehensive hub for engaging patients in their own care. Now, on the right, we have the typical components we find in patient portals. All features which provide the basic functions and could work well if implemented properly, both technologically and operationally. Now, while not all patient portals are made equal, these options are generally available in most, if not all, portals and should be considered in both the patient portal selection process if you are either implementing or replacing your current portal, and then subsequently the setup. Now, Dr. Izquierdo, do you want to quickly talk about the various functions of the portal?
Yes. So I think one of the things that we all need to realize is that when we implemented a portal, it was so that we could check a box in the meaningful use dollars that were coming. And for the most part, we didn't spend a lot of time thinking what the portal could do for us. We just wanted to make sure that we met, the 50% and the 5%, and we all got our board members to use it and try to get to those numbers. I think it's come to a point where we need to look at these different elements a little bit more carefully. As Fernand was saying, one of the things we use portals most is to give access to information. So here, I got your labs, here are the labs. If you're lucky, you'll have the provider sending a note with the lab so that people can interpret a little bit what is going on. But this is sort of the use that most people make of it. Medication refills is also another use. And although a lot of portals have specific ways of doing this, in my experience, I find, and I do see a lot of low income and low literacy Latinos, they just say, they send me a note if I'm lucky saying, can you send the medicine? That's, in a good day what you get. So how do you set that to actually make it efficient in terms of medication refill? Patient and team communication. All this is around like follow-ups, right? So when you have patients with depression or you have groups of behavioral health, you can use the portal, if set properly, to do ongoing follow-up. And it can also be initiated from the patient, which we see more of in terms of, I need this, or I have a sore throat, or whatever. Self-scheduling. Every time we say self-scheduling, people sort of develop a rash and people are very uncomfortable. Part of it is because we have very complex scheduling rules. So we don't have a short and a long appointment type, which is what is recommended from the quality perspective for access. We tend to have very complex scheduling rules. So it is hard. Now, that doesn't mean that there are certain visit types that you cannot allow patients, like you can allow patients to schedule the physical or their regular follow-up. So there are ways to think about it. Pre-visit form, and this is super important. We were in a meeting last week, I think, with a client, an FQHC, that is like, you know what? All the forms that we have for our patients are in paper. We are struggling with this. So we sort of set their forms in their portal so that now that we're doing a lot of telemedicine, the portal can be of assistance to get all this information. And then a lot of portals allow for online billing. There tends to be a cost to it, but sort of consideration should be put towards, how likely am I to get paid if I make it easier for people to pay me, as opposed to the 50 steps that they have to do it if they come in person. Fernand.
All right. Now that we have our starting point, let's talk about the primary consumers of the patient portal, the patients and the care team. Let's start with the patients. Now, a 2019 study by Cognizant on helping people heal found that there are 9 areas on how patients want to be engaged. One is that they want help measure healing according to their life goals. Another is they want help to minimize the impact of the illness. And another, they want help connecting and healing with their circle of care. Now, this study and others like it help reveal that patients really want to be engaged at 3 levels. First level is healthcare. If they're sick, they obviously want to get well, but they want to be able to easily engage with their providers. And if technology is the way to do it, great. They just want to be able to engage easily. Now, wellness is another level, and preventative care. They want help being able to see the cause and effect, right? That's one of the responses that they gave. And the last level is from a community standpoint. They want help being able to share their story and also help personalize their healing journey. So that is healthcare, wellness and preventative, and community. Now, the key to engaging at these levels requires that your strategy is convenient to the patient, useful for the patient, and reliable. We need to give patients a good reason to engage with us beyond the office visit. Now that we have a bit of what the patients are looking for, let's talk about why it's difficult to give them what they want. Now, here are some perceived fears of portals and patient engagement, and why these are barriers we're putting on ourselves. Dr. Izquierdo?
Yes. So part of my job is to talk to my peers about all these fears that come. And I think Jonathan had brought up the increased burnout, so we'll address that one too. The scheduling is a big issue. And I think the response to that is you don't necessarily need to publish all your schedule. You may want to start slowly, publishing small, easy amounts of your schedule, like well child, right? No, school physicals, things that are obvious what they are, and then move from there as you work out the kinks. So that is a big one that we hear a lot. The second one is the open communication with a physician. And although this should sound like a positive, a lot of people are like, oh my God, I'm going to be bombarded with communication. And, you know, I am going to be, you know, overworked with this. In my experience, and I continue to be a practicing physician, if you're timely in your response, and this is a big if, but timeliness in the response will actually not make that happen. Because if you're timely in the response, whether it's over the phone or whether it's on the portal, they will not call you 3 more times, you know? Now, if it takes you a week to answer through the portal, then you will get the question through the portal, then you will get it on the telephone. They will text you if they can. So I think part of this is who answers things, and we will talk about that later, but also how timely are we able to produce communication, and how do we set expectations, right? In PCMH, we were asked to have policies that told our patients, you know, for a refill, I'll take 3 days. I mean, you need to figure it out because before you are out of medication, because it may take up to 3 days or whatever it is, right, that your organization's policies are. So this is another one of the big concerns we get, increasing operational workload and sort of, okay, there's one more thing we need to do. And I have to tell you, in my experience, if a portal is well managed, it's not another thing, it's instead of. Again, there are a number of things that we will discuss that you need to make sure that are well set in place for that to happen. Increase staffing. You know, do we need a portal manager? How are we going to manage? Our IT people will have one more thing. And yes, this is a new thing, but look, in the last month, you just converted into a telemedicine model. So it's just, how do we shift the responsibilities of people so that they are not additional but different? Increase liability. And I think for this one, I've heard it not a lot. There's some people concerned about this. I would say you need to have a policy that tells you what interactions you are willing to have with patients in the portal. And this is very organization specific. You know, some organizations are more tolerable, more tolerating of risks, some less. But this is really about, you know, it needs to be clear. Someone cannot tell you they are having chest pain through the portal, right? So how do you communicate that to the patient, and how do you have someone monitoring so that when that happens, you can respond more immediately is an important piece. Patients' perceptions of portal usefulness, I think we did a big disservice to the portal when we implemented it just as a tool for meaningful use. I think we did not dedicate enough time to think how we were going to do this. We signed up people and they didn't get anything about it, out of it. So now they're like, oh, no, I tried that. No, thank you, right? So how you don't have infinite opportunities to do this right. You need to think it through and do it right before people give up on you. The low literacy level is true for people that are completely illiterate. You know, people that cannot read or write won't use a portal. That is not so true for people that are somewhat illiterate but can read. You know, I have patients sending me notes, and sometimes I'm like, their grammar is so terrible that I have to pay attention to what it is that they're saying. But it can be done. Okay. And then the other thing is that providers will tell patients not to use it or use other means, and that happens. But it's also engaging your providers to see how we can do this and make it beneficial for them. Is something we're going to talk a little bit more. Our EMR cannot do it. That was more of an issue a while ago. It's not so much an issue right now. Most EMRs can do it. Otherwise, there are still standalone portals that you can use. Patient access will not have impact on satisfaction. And this is something that depends what the same as we were saying with the burnout, right? It depends on you setting the procedures to make it a good experience for your patients. You know, we have implemented portals by clicking on the technology, and we have generally not dedicated enough time to think about the workflows behind them. So I think we'll talk about some of these things for you so that you have sort of some elements to think through. But if implemented well, we have seen very good satisfaction levels with patients. And then age. So here's what I say with the age. I'm a geriatrician. My practice has patients 50 and over. So we use the portal. And different people use technology differently. And a lot of my patients, their grandchildren or their children are the ones using the portal instead of them. But age, don't assume that just because someone is old, they're not going to want to use it. I have not found that to be the case. And even some people that I was like, I'm not sure I should insist too much, they end up being one of my biggest users. So yes, I think it's an element that may end up being problematic, but don't assume that anyone that is old won't use it. Nor do you assume that anyone that's young will use it too. But I think you need to not make assumptions in this element. Hernan?
All right. So we talked about the patient end of things, and we talked about the providers. So just to recap, the patients, they want to be engaged in a way that is convenient, useful, and reliable. And to echo some of the sentiments that Dr. Izquierdo just covered, is that a lot of the things that are fears are really just misconceptions and fears that once you start really drilling into the benefit to not only the patients, but also to the care teams, that there's actually a lot to be gained. Now, shifting gears a little bit, how can you increase your portal adoption? Now we can look at from both the workflow and also the patient care team end of things that Dr. Izquierdo is going to cover.
So let's look at the workflows, right? What we say that a lot, so forgive us, but this is a very important. If this is going to take 50 steps to the patient to do, they are going to end up not doing it. So, for example, the setup of the portal tends to be cumbersome for patients, and unless you support them, they end up giving up in the middle. Now, then to log in, you are able to log in into your phone app with a 4-digit code, right? Which people can do. So maybe you want to look at the setup of the portal with someone to support, you know, whether in the front desk or you have a volunteer from the community college that you're supporting, or you have to look at what would work for you. But I find that the setup of the portal for our communities, the communities that we serve, tend to be one of the barriers. So if you think about how to set it and just give a brief orientation, and we have seen people that created a little video and they had it in the waiting room. And you know, the front desk would offer, do you want access to your portal, to make sure, you know, that video will tell you how. So there are different ways of going about it, but the sign-in tends to be problematic. And then the way you set it, if just to access the labs, you have to click in 5 forms, they may not end up doing it. So make sure that when you set it up, it is not annoying for the patients to follow up. The other piece is that when you look at the workflows, you need to make sure that portal is a substitute for manual work for your staff and not an addition. And this can be done, right? How are you going to do this? There are EMRs where you can fill a form in the portal, and then you can click it and add it to your note when the patient shows up. So again, how do you work through the workflow of what goes into the portal and what comes to you in a way that substitutes work? Then I think one of the things is, how do you ensure that the portal is the preferred means of communication? And in our practice, what we did is we make sure that any message that comes to the portal is answered first. Then the second one is the messages that come through text. And the third ones are the messages that come through phone. And what that does is that it gets people used that they are more likely to receive the answer faster if they do it through the portal than if they call you. A call takes much longer to process than just a message. Now, it is true that in a call you can get all the information, and sometimes you need to send 3 messages. So until you get all the information, it happens. But again, this idea of how do you respond to communication in a way that enhances the use of the portal is something you're going to have to discuss. The bidirectionality, we have done a lot of unidirectional communication from the team to the patient, right? So we do, we push reminders, we push certain things. You need to start thinking about bidirectionality. There's a lot of studies around, for instance, behavioral health check-ins through non-synchronous portal communication. But you can be creative. Your diabetes groups, your hepatitis C groups, a lot of these chronic condition groups can benefit from this bidirectional communication. And then, if you give patients access so that they can go to another provider and show them the labs, that was also actually helpful for them. For now.
All right. Now, once you're ready to market your portal, there's internal and external considerations to be mindful of. Brandy, do you mind putting up poll number 2 for me, please? All right. Very cool. Thank you for that. So just continuing with that from a marketing point of view, Dr. Izquierdo is going to review some key questions you should be asking and some considerations you should also take into account for both internal and external marketing point of views. Dr. Izquierdo? So
generally, when I started in my career and I heard the word marketing, it was uncomfortable because it felt like I was trying to sell something that people didn't want to buy. Here, when we talk about marketing, it's really about understanding the population that are likely, which of our patients are likely to avail themselves of the technology. And then do we have internally and externally the resources to support it? And finally, can we get internal buy-in? One of the things in my experience that will get the patients to use the portal more is if their doctor, their nurse practitioner, their nurse, their MA tell them, oh, use it because it's cool. I'll send it to you. Like the second I have the results, they'll pop up in your portal. This is gonna be the best thing since sliced bread. And then people are like, oh, okay, this is good. So when you look at how you're gonna make sure that people use the portal, one of the constituents that you need to look is your own internal constituents, your workers, because again, a lot of people have this sense that, oh, it's one more thing that I'm going to be asked to do. The providers, oh, it's one more way that the patients are going to be able to, to ask questions. And I'm already, busy with the 50 other things that I'm supposed to be doing. So be very cognizant of that. If you set the portal as an alternative and you are able to discuss that with your staff, you will actually get a lot of buy-in. If you set it in a way which is additional work, you're in trouble. Okay. Some people, and I haven't seen that very often, but some organizations have set goals for adoption and have set incentives. Generally, the incentives are more helpful for support staff. But it's something that we have seen done, and you consider it. The idea that this is a not concurrent way of communication, that you don't need to call 3 times until you reach someone and let them know what it is that you need to let them know, but it's not concurrent. It's also a big plus. And make sure internally part of your marketing strategy is a good training so that people know how to use it properly and how the patient is supposed to use it so that they can be supportive of your patients. Okay. In terms of the marketing towards your patients, clear messaging. Again, tell them, if you have chest pain or shortness of breath, don't be using the portal. It's not the way, right? Or things like, and I think someone was talking about the bidirectionality. Just tell your patients, do not say thank you. Okay, do not send me a note to thank me for whatever message I sent you. I still struggled with that one, as you can see. But sort of setting some expectations for your patients is useful. Again, what we were saying, prioritize portal communication over other types of communication will help. Creating videos and trainings for the waiting room. We had a client that had some volunteers from the community college, and that's what they use them for, to be on the waiting rooms training and enrolling patients. And then make sure you have point of care enrollment. If you send it and they have to do it home, it's probably not going to happen. Renan?
All right. So earlier we polled on COVID-19, and we want to just briefly talk about how COVID-19 can be factored into your patient engagement strategy. Now, COVID-19 has been incredibly disruptive across every industry, okay, maybe except for Netflix, but it has been especially disruptive in healthcare, and I don't need to go into any reasons why. I mean, you guys know them all, but it's now more than ever become increasingly important to have a comprehensive digital strategy around patient engagement in light of COVID-19. Now, here are 3 areas among many that we're seeing patient engagement being leveraged in light of this novel virus. So 3 components: 1, broadcast communication; 2, chat and secure messaging and that bidirectional communication that's non-concurrent that Dr. Izquierdo just mentioned. And then 3, being able to digitize your COVID screening and using and leveraging telehealth technology for your visits. Dr. Izquierdo, did you want to expand a little bit more?
Yes. So I think the first one is maybe one of the most important. You, as the primary care of underserved communities, are a trusted source of information. And there has been like the most incredible, I got a text from a patient saying, hey, I was told that every morning I need to breathe deeply to make sure I didn't have fibrosis. And then if I cannot take a deep breath, it means I have fibrosis and I'm going to die of coronavirus. So I'm sure you have had all these experiences in terms of inaccurate communication. I think the portal is a great tool to send regular information, right? So the governor has said this is what it means for you. CDC has recommended this is what it means for you. et cetera, et cetera. So this is very important. The other thing is the engagement of high risk, and in this case, for instance, the engagement of COVID positive patients, right? So you may want to set up a communication a week after you have diagnosed someone with COVID to check that they're progressing in the right direction versus no. That is important. One thing, and I think Davida had brought this up, about how to make the bidirectionality less stressful. You have a lot of very anxious people out there right now with a COVID, and you need to set up a number of communications that are sort of engaging and that are, I would say, reassuring, after which you just schedule a telemedicine. So if, in our clinic, we have 3. If we get 3 portal messages of the same subject, and, it's not a clarification of the previous one, but the same subject, we just convert them into a telemedicine visit. It just, there's some people that are so anxious that will not benefit from this asynchronous communication. There are other people that need other kinds of communication, particularly with literacy, that they will use the portal to look at the labs and to look for sort of simple messages, but that when they need to process complex information, they do not do so well. So be prepared to have a number of communications, and you need to be flexible. Sometimes you can just, with the first text, you can see, with the first note, you can see, let's do a telemedicine. But the idea that you will flip it into a teleconferencing mode is going to be something you need to consider, and to train your staff to detect, sooner rather than later. And then again, what I was saying, how do we monitor, how do we incorporate the portal into your telehealth? It's sort of, do you set up, after you diagnose someone, a telephone encounter so that someone can send a check-in in 2 days, or whatever? You'll have to figure out what works for you. But that idea of monitoring people so that we can keep them out of the hospital because there's someone that's checking on them and they have a way to reach out to us too. Hernan?
All right. So before we move on to the next slide, I just want to take a moment to review some of the questions that are being put in the chat. So Dr. Izquierdo, do you feel that portals help more work onto the medical team, potentially pushing individuals into burnout? What are ways to mitigate?
So I tried to answer that when we were talking, but I think you need to set up the policies of the portal well. In my experience, in our organizations, and for me with my patients, it has reduced the amount of work that I have had to do. I also personally hate getting on the phone. It takes me like 50 more hours to do phone consultations or, get back to people over the phone. So I was always a very happy person with a portal. But this idea of how do you set it? And does the burden of portal management need to fall on the providers? And we will see later on that not necessarily. There are different ways of going about this, and not necessarily all needs to fall in the provider. So I think how you design the use of the portal is going to be the answer to that particular one. And I have people that feel burnout, but it's because it was not an alternative, it was an addition to their workday. So that is very important as you decide how to set it up, that it becomes an alternative and not an addition.
Awesome. So I have another question here, Dr. Izquierdo. So in the current era of COVID-19, have you seen the portal being utilized more bidirectionally, and what are keys to making it less painful? And I think we covered part of that.
Yeah, so the problem we have right now in making generalizations with COVID-19 is that the era of COVID-19 is really a month. So we are starting to see some trends, but we think that we're seeing more portal use. I want to caution you. If you're gonna use the portal more, you better make sure you have policies, procedures, and workflows behind them, because we have been a little bit brave in, we have been able in a month to change our way of delivery of care, and this has been phenomenal. I mean, I'm very impressed with how we have been able to do this, but now we need to sort of take a step back, take a deep breath, and sort of scrub the surfaces and make it a better process, both for telemedicine and for and for the portal. And then again, what I was telling you about the bidirectionality, I think you need to have a trigger after which a communication is converted into a visit. And, now with the telemedicine, you and people staying at home, you don't need to get people to stop work to come and see you. It's even easier to offer a telemedicine appointment. So just think through when you're gonna flip communication into a televisit.
Awesome. All right. So just in the interest of time, we'll keep moving and we'll address the questions as we go. All right. Increasing patient engagement beyond the portal. Now, the portal is a great way to engage patients, as Dr. Izquierdo just highlighted, but your patient engagement strategy shouldn't end there. Let's look at some relevant data from the Pew Research Center. While traditionally the thought process has been that there's a gap between broadband availability between majority and minority racial groups, broadband access in the home has been increasing year over year, and we're seeing a large availability across the board. Now, with slight dips in 2019 in Black and Hispanic groups, by and large, we can derive that broadband availability is ubiquitous. However, by income level, we see bigger gaps in broadband availability in the home, but I think there's a reason for that. Now, the Pew Research Center went further in that study to determine what was up with the non-broadband users and found that smartphones are becoming more and more prevalent. In terms of patient engagement, this shows an opportunity to engage patients where they are. Now let's talk a bit about non-portal outreach. Now, while promising healthcare organization can't just rely on portals to comprise of their patient engagement strategy, it needs to take into account several other factors. Dr. Izquierdo, do you want to talk a little bit about goals of the outreach?
Yes, and I think this has been always the case, but we can adapt it to the COVID at this time. So the first one is typically you are due for your physical, you are due for your mammogram, you are due for whatever it is that you do. So kind of engage patient in their care activities. The second one is more a symptom check and a well-being check. Right now, this is ideal for COVID follow-up, right? So you can look at the patients that are diagnosed with COVID or respiratory symptoms and set them for an automated message in 2 days to make sure that they know that we are paying attention and that they can reach out to us. So this in the area of COVID is important. Are you doing what you're supposed to doing? Are you taking your medicine? Did you go for the walk? How are you, doing in the things that were part of your goals of care? The fourth is always education. I mean, texting and education are, especially when the education, like, when the CDC recommended that when we left the home, we needed to wear a mask. So a quick text for everyone. Recommendation has been issued. When you leave your home, wear a mask. That kind of patient education that can be very useful in terms of texting platforms. Things that happen in your organization. For instance, if you are coughing or have a fever, we'll do a telemedicine. Whatever kind of information about the practice and practice changes you want to share is also very useful in texting. And then, and this is one of those that it is from the patient to you as opposed to the other way around. So if you can not accept texts, it becomes a little bit cumbersome to do this one. But sort of, I'm going to the hospital, or I was diagnosed with a stroke, or whatever high risk events that you want to identify, and let people know that they have to call you. I'm feeling suicidal, whatever it is that you think of as a high risk event that you would want them to let you know. And then, outreach. And this is more as we move towards value-based purchasing, where we're going to be responsible for panels, and patients in our panels have not necessarily come and seen us. We're just going to be assigned certain patients. So, hey, we're your doctor of record and we have not seen you. We want to introduce ourselves, yada, yada, yada. So some of these things are particularly useful during the COVID crisis. Some others are just part of how you need to think about your messaging strategies. Bernard.
All right. So a couple of different ways to meet these goals. Now we can look at existing and emerging technologies for each, starting with e-registration and check-in. Patient intake forms connect to your EHR and help increase the accuracy of patient information and increase the throughput at the front desk. There are companies like Phreesia, Relation, and Easy Access that connect to your EHR and conduct this type of functionality. Now, from an electronic patient follow-up standpoint, in addition to the portal, digital reminders sent via SMS, automated voice, etc., help to ensure that the crucial follow-up education and engagement is happening to promote wellness and prevent avoidable ER admissions. There's also a large adoption that we're seeing of broadcast messaging. These really help to relieve your call center staff from having to conduct manual calls to promote engagements like flu clinics, health fairs, or preventative visits for certain populations. Companies like Care Message, specialize in these types of broadcast messaging, but there are several others that we're seeing in the marketplace. Electronic surveys that are sent via phone apps or via links using SMS are super helpful for the practices to be able to solicit that necessary feedback to improve the different areas of their operations. Remote monitoring, not necessarily from the perspective of telemedicine, but from the perspective of leveraging the technologies patients are using in the form of wearables. Monitoring programs can collect a wide range of health data from the point of care, such as vital signs, weight, blood pressure, blood sugar, blood oxygen, heart rate, you name it. From a patient-facing chronic disease management, there's tools popping up like MediSafe, which is an app that helps patients manage medications, or Fujicate, which is an app that helps you track your diet and make healthy choices. Now, scanning the marketplace to see what your patient population is like and what they're using, and promoting these within your patient base really will help you to identify where your staff and strategy need to be so that you're able to leverage the data that's already being captured by your patients. And of course, engagement in the clinics. Very basic, but very useful, are just continue to use daily huddles and pre-visit planning to make sure that that's happening. We should definitely go a long way to help engage patients outside of the clinic, but let's not forget to try to make the most out of those visits and make them as meaningful and productive as we can. All right. So quick time check. I think we're definitely pressing in here. I think we have about 10 minutes left, so I'll quickly go over some of these things if that's okay, and then we'll review the questions at the end. In this section, we want to talk about the practical considerations to take into account when deploying patient portal and patient engagement applications, and what key areas are so that we can see the adoption and success of these tools. Step number one, you have to shift your organization's mindset about patient engagement. So to do this, you have to shift your thought process from tactical to strategic. Oftentimes we see projects come up not really in the context of a broader picture, but perhaps because of a tool that a fellow health center is using, or someone attending a webinar for a sales demo. I mean, I think these are all great in terms of understanding and knowing what's out there, but it really needs to fit into a broader strategic picture. Now, patient portal and patient engagement also needs to be viewed as an opportunity versus a burden. I mean, we talked about the fears of adopting a portal, from a provider end, and potentially increasing workload, but taking the perspective of these are opportunities to streamline and automate versus continuing to do the same things that we've always done that hasn't really allowed us to scale from a patient visit volume point of view. You have to also define your vision and clearly state your goals and objectives. I mean, I think just being able to do that gap analysis, which we'll talk a little bit about in an upcoming slide, and really use that as the data that you need to be able to bullet out what your goals are as part of your patient engagement strategy. And as part of that, you also want to make sure that you're associating metrics, that you're able to track what your money is going into, from these one-time capital expenses to seeing how that really brings in the ROI over time. And of course, you have to identify the right tools and technologies that meet your organization's goals the best. There are so many tools out there that fit into different aspects of patient engagement. And the best tool out there might not necessarily be the best tool for your organization, depending on what your organization's ability is to support. Sometimes something that's a little bit more simple is better than something that's more robust if your organization can only take in so much. Now, also don't understand the importance of a successful implementation project team and plan, which we'll talk about in a little bit. I mean, you can purchase the most expensive tool out there, but if you don't have a strategy to deploy it, it's going to be a gigantic waste of money. And then last, review, assess, and improve. This needs to really happen on an ongoing basis for your patient engagement strategy. Dr. Izquierdo, anything to add before I move on to the next slide?
No, just that I think if you hear something from our talk today, be strategic. We've been very tactical about portal. We need to change and look at it as a more strategic overall way of doing business.
Step number 2, like I mentioned, identify the gaps and opportunities. So here are 3 sample ones that you can start with. Look at it from the lens of automation. There are several things like patient reminders. If you're not already doing that, being able to offload a lot of the work that your staff is conducting from a manual patient outreach standpoint, calling patients to confirm appointments, things like that. Those are definitely things that you want to account for in your strategy. Patient education. Like I mentioned earlier, there are tools out there that allow for just engagement for patients that fit a particular disease process, that allows your technologies to conduct automated outreach based on educational material that are being pushed out over the internet. Lab result notification. I think Dr. Izquierdo touched on this a bit. You can really take an approach of offloading a whole lot of the manual calls that are happening to notify patients of their lab results, taking an approach that the normals are being sent via messages on the portal, and the abnormals or the exceptions being the things that your staff are conducting manual outreach for. And of course, bill pay, something that definitely helps with your collections, being able to deploy solutions that are easy to use, incorporating it within your portal. Those types of things are, I would say, gimmies for your strategy.
And
Second,
can I say something? You don't
yeah.
necessarily need to choose to just send the normal labs, because if you just do the normal labs, you're not going to have many of those. But there's certain labs that don't need a lot of explanation. A high cholesterol, an hemoglobin A1C of 7.5. All these things don't need a lot of explanation. You already had these discussions when they were there about healthy eating. So, an automated note that says, hey, the cholesterol was out. Remember what we talked in the appointment about healthy eating and exercising. So you need to figure out which abnormals you're going to be able to automate and which abnormals are going to have to be giving a little more explanation. Sorry, go ahead, Fernando.
Yep. All right. Another lens to look at it from is streamlining. Things like medication refills. Those requests should be funneled through the portal as best as we can. Patient health information access, being able to ensure that your portal is configured in a way that covers 80% of what patients typically call the clinics for to be able to solicit information about their own patient record. Things like scheduling, can definitely be offloaded for self-scheduling processes that your patients can, leverage your portal for. And also very important, and Dr. Izquierdo talked about this earlier, is being able to pre-fill forms, in advance of the visit. These are the types of things that will help shave off time in your, patient visits and allow those visits to be a lot more productive. And from a communication end of things, just being able to, use your patient communication and patient care by leveraging these technologies, definitely an aspect that you want to capture in your strategy. Reduce avoidable patient visits and calls. Like Dr. Izquierdo mentioned, being able to respond to a non-concurrent message on the portal is going to be a lot less taxing on your workforce than it would be by having to, receive a phone call, having to call back and doing that, phone tag game. And engaging patients conveniently. I mean, that should be a big focus. That slide that I covered earlier on what patients are looking for, they want to engage their care providers in a convenient way, in a way that's useful for them and reliable for them. And your technology strategy around patient engagement really needs to look at that. All right, step number 3, planning and execution. There's so much here, and we could spend probably an hour just on these things alone, but very, very important. Once you have your strategy in place and it's time to start putting it into action, make sure that you cover at least aspects of all 8 of these areas. From a project governance and management standpoint, you really need to have a structure that takes into account all of the different stakeholders within your organization. So you're not just making decisions unilaterally, but you're really taking into account all of the necessary inputs, and that you're putting and constructing the workflows in a way that integrates all of the different aspects of the organization. As part of that, that will help you obtain the clinical and operational buy-in, or else these things that you're rolling out will just fall to the ground if nobody actually believes in them. Nobody feels like they had their voice represented in what is being rolled out. And that plays into a big part of the internal marketing that Dr. Izquierdo talked about. Policies and procedures are going to be key to making sure that the providers, the clinical support staff, aren't feeling even more overwhelmed and burnt out than they already do. Constructing a process that allows the organization to, roll out new features, whether it's in the portal or patient engagement, that is accounted for, thought through, is going to be key in having these documented policies and procedures. And of course, there's the component about the technological build, determining who is best to make these builds, whether it's IT, whether it's combined ops, IT, medical, just being able to account for that in the project plan and making sure that these things are being built out and communicated in an appropriate manner. You're also going to want to make sure you have process auditing components included in your strategy. Making sure that if you are enabling a function within the portal that allows folks to send messages, that these messages aren't just sitting out there and causing a liability for your organization. Things that you'll definitely capture in policies and procedures, but that you'll also have a process on the back end of things to make sure that everything is being followed through and that things aren't falling through the cracks. And like I mentioned earlier, you're definitely going to want to have some baseline metrics and post-deployment metrics so that you're able to gauge and determine and track really all of the work that you're doing so that you're able to see the areas that could use improvement. Models of portal management. Dr. Squerda, did you want to briefly touch on this?
Yes, I think this is one, when you look at your policies and how to the workflows, you need to settle for one or the other. You can combine them, but you can either choose a funnel model where all portal communication is funneled through portal manager. And depending on the size of your organization, that would be a plural. But this idea of having someone review everything that comes in and then assigning it to the right person, whoever had brought up the burnout, these actually, in practice as well as in theory, make people feel a little bit less worried that they're going to get all these things that they're not their job. Now, the pros of this model is they don't rely on patient assignation, and we'll talk about what that means. And that the portal manager can resolve some of the issues before they get to the staff. So you may get requests for fax my notes to somewhere, or I need a copy of this, or so the portal manager can actually solve a lot of these problems before they get anywhere. The cons is that, of course, you have another staff member. Now, if we have learned something with this telemedicine shift, is that we are going to have to rethink the job descriptions for some people, right? So it may be that you don't need to hire someone else, that you just need to reshuffle that position. But that is something you need to acquire. And the other thing is that it requires an extra step. So if it ends up being a question for the provider or for the nurse, it requires someone else to have looked at it and assigned it. So, and the assignation models is that you automatically assign. So if a portal message comes with question, it goes to the provider. If it comes with appointment, it goes to the front desk. If it comes with medication refill, it goes to nurse, so on and so forth. Now, I think the issue with this is the assignation, the patient assignation, which essentially means, and I always tell, not all is gold that glitters. I always tell this example where I got a message, and in our organization, we have 72 hours to fill refills, requesting the title, the note type, and the title was refill request. And then when you read it, it said, can you please send me a refill of my blood pressure medication because I'm having a lot of chest pain? Okay, so the patient thought that this was really about a refill, but when you read it, it's really a sick question, right? It's nobody should ever send a text about the chest pain, much less through a refill request. So the problem with using the assignation model is that you will miss this ones. So having a portal manager, make sure that someone actually reads the whole message so that we can catch those, but not everybody has the internal capacity to have another staff member taking care of that. So just think about it. Just on pure sort of clarity, we have an assignation model. So even that we had that case, we continue to have assignation model, and we try really hard to go over the messages at least twice a day to make sure we're not getting any of those. But if you have a small organization, you may need to do the assignation model and not the funnel model. Fernando.
All right. And I apologize. I know we're super running over here, 7 minutes over, but future considerations on patient engagement. I think in the near term, there's an increased importance of patient engagement in light of COVID-19. I think everyone, just based on the chat messages and just what's going on at the health centers, that this is going to be key. Second, there's definitely going to be an impact on the increased adoption and utilization of FHIR APIs. I think just the more rapid and the volume of data that we're going to see from an interoperability standpoint and being able to have a comprehensive view of the patient record is going to impact how we engage with patients electronically. And then naturally, as the growth of HIEs and increased ability to collect and aggregate data is going to make more available the patient data that we need to be proactive, to be able to treat, to be able to aggregate that data and see what our communities are looking like and try to be as proactive as we can. I think are all going to be factors that patient engagement is going to have a central role in. Now, I apologize that that last section was a bit of a frantic rush to try to get the content in, but hopefully this presentation was helpful to you all and that you're able to take away some nuggets from it. Like I mentioned, if there is any questions in particular that you would like to email us about, Brandy has that information, and like she mentioned on the chat, this presentation is going to be made available on their website. So thank you all again for taking the time this afternoon to join us, and I hope that everyone stays safe out there and has a good rest of your day. Thank you, everyone.
Vernon, did you want to take a couple questions if there is any that haven't been addressed?
Yeah, sure. Absolutely. For those that are willing to stay on, yeah, we are here.
Okay, if you want to raise your hand, I can unmute you if you have a question. I have one right here. Okay, Chris, you're unmuted.
Hi there. So Fernan, you mentioned some vendors for the patient intake that can work so that they could fill out forms and stuff, because we have that current roadblock right now because we can't do that with our portal.
Oh, got it. That's interesting that you can't do it with your portal. So, I mean, there are several organizations out there that sort of specialize in this. Give me 1 second. I might be able to find that list. Okay. Actually, do you mind just sending me your email on the chat and I can shoot you a note?
Sure.
Is that okay?
Yep.
Awesome.
That's
awesome.
perfect. Except I can't figure out how to get back there.
I mean, Phreesia, Relation, Easy Access, they all have those types of capabilities so long as your EHR can integrate with them. There's another also, it's called, oh gosh, the name escapes me, but I'll send you an email. I just got it. Thank you. And
Okay,
sorry, Dr. Sarah, you were saying?
Yeah, I remember a question that mentioned that you guys have a lot of Native American reservations as patients and that the broadband is not existent. I have to tell you, the majority of my patients don't use the portal through a computer. They use it in the app version in the smartphone. So I think more and more broadband becomes irrelevant. Now, the question is, do they want to use their data to communicate with you, or they prefer? You need to give them a reason why using the data minutes in you is worth it, right? And that's all we talk about, the workflow and the immediacy of response. But I think more and more we're relying on smartphones to access these kinds of applications. And then,
awesome. Okay. Brandy, any other questions from the group?
I don't see any other raised hands.
okay, there was, okay, so there was someone that, I think Vincent, I don't know if he left, but he had said some strategies to optimize patient engagement through telehealth technology. I think we are in the early ages, so we don't have 50 ways of doing this just yet. We're learning as we go. But I think you need to think about communication as a continuum. So if someone reaches to you via a text, and it's a yes or no question, or it's a very simple one sentence response, by all means, maintain the text communication. But I think you need to see your communication as a continuum, right? And what I was saying, don't be shy about converting one text into an appointment. I'll give you an example today. I had a patient that yesterday went to the ER because her blood pressure was very high and we could not control it with portal communication, actually. So we just sent a text to her today saying, how are you doing? And then she responded, oh, I went and they said this, da 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 da. So she had 3 questions at the end of that. So we immediately converted into a telemedicine visit as a follow-up for an ER visit. So this idea of making sure that you don't see these technologies as silo technologies, but that you're able to skip from one to the other, and make them part of a continuum. So the patient never gets this idea of, you know what, you need to call this other person to get this service. But it's like, oh, someone will call you and schedule you for a telemedicine. So it's your burden to make it seamless and not the patient's to access the right resource, if I'm making sense.
I don't see any other questions. So thank you, Fernan and Anna Maria, and thank you to everyone for attending today's webinar. Once you leave, you will receive a survey on the presentation. We'd appreciate if you complete that to provide your feedback. On behalf of Nevada Primary Care Association, thank you for joining us today and have a great rest of your day.